Preparing for the Tokyo Olympics in 2019, Canadian softball player Larissa Franklin says she could feel something was wrong.
I just had this mindset every single day of I didn't do enough.
Anxious about her performance, the now 28-year-old says she was facing burnout. A study out of the University of Toronto found 41% of our elite athletes meet criteria for one or more mental disorders, including depression, anxiety, and eating disorders.
I was quite surprised because that number is quite high, but maybe I shouldn't have been because that's also quite reflective of research from elite athletes in other countries.
UK researchers found 48% of athletes surveyed experienced similar symptoms, and in Australia, the number is even higher at 50%.
There's this really important dedication to the sport that sort of creates the potential for stress.
Canadian athletes cited stress and training load as main factors impacting their mental health. Decorated swimmer Mark Tewksbury highlighted post-Olympic depression in the 90s and says there is support now.
Athletes have access to mental health professionals 24/7 on a telephone line. They have access to appointments whenever they need them. All the teams have a psychologist traveling with them, and Team Canada has a chief medical officer and a chief psychologist that's over there in Tokyo right now.
But for Franklin, seeking help meant risking her dreams.
I felt like if it got back to the coach, then he was going to assume that I wasn't ready to step up to the plate and perform.
On Canada's softball team, Franklin says there are monthly meetings with a psychologist, a proactive approach, experts say, and a start to changing the mental health stigma that still exists in the world of sports. Mauracher, Global News, Toronto.